All right, welcome and let's talk. Right now, this is how students' journey look like. Right, you want to take the NCLEX exam, you got this, right, a resource so that you can be able to take the NCLEX exam, right? Answer the questions correctly, pass the NCLEX exam, and become a licensed nurse. Right. So that's it, right? So with this, you are able to answer the question correctly, pass the NCLEX, and become a licensed nurse. Right. So that's what you want to achieve from any form of this that you are using. Right. So now this can either be question bank, it can either be content review, it can either be a coach. Right. Now, how do you use question bank? All you just need to do is to log in, answer the questions, and then if you feel prepared, you take the NCLEX exam. Right. Now, content review, you study, plus you have the right knowledge related to everything you've studied. You practice question, you answer, you just like this part. So you practice question, and then you are able to like answer the question, right? You were able to answer, sorry, answer S is not there. Right. Answer the question, and then you feel ready, right? And then you take the NCLEX exam. Now, with a coach, the coach show you the plan, and then you will follow the plan. You feel ready, you take the NCLEX exam and pass. Right. So, but now you are here because of this. The third one, a coach. Now, from me right now, you want to know what is that plan, right? That I'm going to use to help you pass the NCLEX exam so that you can follow the plan. So if you are using a coach and then you don't even know the plan, why are you having a coach in the first place? Right. Like this is the plan right here. This is the plan. Very simple. You see, this is what you do in 60 days. You can see I just like put it in just this small piece of paper. This is what you are doing in 60 days that will help you pass the NCLEX exam to show how NCLEX is not difficult. I'm going to put it on the screen. Now, I want you to know the plan and then you follow it. If you follow the plan, you are going to pass the NCLEX exam. Now, let me say something real quick, right? Let me erase what is on the screen so that I can put it on the screen so that you can understand. Okay, so now I have learned this over the last 3 years, and I'm going to explain using something common. Let us say this person is thinking of how to make money, and then this person right here knows how to make money. He's a financial expert, and then told this person how to make money. The chance of this person implementing this, right, is not that high. It's still low, despite the fact this person wants to know how to make money. Now, how do you influence this person to take this action? You don't tell them how to make money. Instead, you tell them what will happen if they don't have money. If I tell you what will happen if you don't pay for to receive a particular care you need related to your health, guess what? You will take it serious. If I tell you, oh, you need blood transfusion, right? Transfusion, and you need to pay for it, right? Now, guess what? And I tell you, oh, if you don't get this done, right, you will die, right? You will see the need to do this, right? So if I tell you this is what happens if you don't have money, then you will see the need to learn how to make money, right? So that is what I do, right? Previously, I've been coaching for the past 3 years, right? I've been coaching for the past, let me just erase this. Hold on. So I've been coaching for the past 3 years, and what I always used to do is to put my plan in front of the students, right? So let's say these are the students right here, right? I put my plan in front of the students, and then the students are going to look at the plan, and maybe just two will follow the plan, and then you see these three, they will just be doing whatever they like. Not because the plan is not good, but because they have not seen the need to do what they need to do in order to what? Pass the NCLEX exam. Now, and why? Because you will say, but anybody that will pay you that amount of money for you to coach them, they actually see the need to pass the NCLEX exam. The truth is this: many people think of how to pass the NCLEX exam, but they don't think of what they will do in order to pass the NCLEX exam. It's just like many people can think of how to make money, but many people will still decide how they want to make the money. Some will say, oh, no, 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 no. Yeah, I know that can really give me money, but I don't feel comfortable doing that kind of job. You see, that gives them the money, but they are not thinking about the money they want to, make. They're thinking about what they need to do in order to make that money. So students don't think about the plan that gets them to pass the NCLEX exam. They think about what they need to do in order to pass the exam. So when they start saying that, to some certain extent, it's causing like inconveniency to what they don't want to do, they don't follow the plan. So that's the reason why I can put this plan in front of 5 people, and 2 will follow it, 3 will not follow it. It's not because the plan will not get you to pass, it's not that the plan is not good, but students are so comfortable in doing one thing. Let me tell you the student journey so that you understand what I'm saying. Right. You understand what I'm saying? Like I said, I've been coaching for the past 3 years, so I understand student behavior. Now, when a particular student is preparing for the NCLEX exam, the first thing they do is to get question bank. A lot of students, millions of nursing students are very comfortable with practicing with questions rather than studying content. They rather practice question than studying content. Now, it's only when they fail, despite using question bank, that is when they will now start thinking of, okay, I guess I need to do content review plus answering question. Now they will not say, oh, I failed with question. It seemed like I have problem with content. So let me review content and practice question. Right. So now when they review content, they practice question and they still fail the NCLEX exam, they're like, oh my God, but I studied the content, I practice question. Okay, probably it's the program. That's the problem. So now they start switching from one program to another. You are likely, yeah, right? Because you have used different program and you did not pass the NCLEX exam. So you are hoping my program help you pass the exam. Right. So now you see, this is where you started from. This is the second thing you thought of. And then you thought of like using different program. So you are not like, oh, I've used question bank, I've studied content, probably now it look like I need a coach. Because this is like I told you, for this right resource, it can either be in form of question bank, It can be content review, or it can be a coach. Right. So it's just the three. There's nothing more you can use. Right. So now most people have done this, they have switched program from one program to another, right? And then now they're like, oh, it look like I need to use a coach. Right. So now when students come joining a coaching program, guess what? This is their default state. They are not ready to study content. They are only ready to practice question. That is it. I'm telling you the truth. So they don't see the need to study content until you show them the need. That's what I'm trying to tell you right now. Like somebody will not see the need to do something if you don't show them what will happen when they don't do it. Oh, I need to make money. Okay, let me teach you how to make money. They start saying, will you be able to teach me right? This and that. But if you tell them if you don't know how to make money, this is what will happen. You will go broke, you will this, you that, so and so. Now the person now see the need to learn how to make the money. So naturally, students think about it. I mean, like when I started coaching, I always like teach content. I mean, now students will start saying, "Coach, when are we going to answer question?" Like everybody, when are we going to answer question? Well, we have not covered the content, and you are asking about questions. So if I give you a question now, how would you be able to answer it? Then I put question on the screen. Okay, answer it, and everybody are like, they don't know how to answer it. Are they not saying that the what gives them the ability to answer that question is the content they know? Right. So I changed my principle. So let me erase this. So because of all this, right, I changed my principle. So my principle now became instead of me presenting my plan, right, to the student, I no more present the plan to the student. So what do? I show them, right, what it takes. So now let me just put this right here. Let me put the 5 students. I show them question, right? So I show them questions and I ask them one question. And that question is this. I always used to ask, when I show them question, I say, what would you need in order to answer this question? And then the student will say, oh, I need to have an understanding of what the NCLEX is testing so that I can apply my knowledge. Great. So if you know you need to have the right understanding so that you can apply your knowledge. Now, let's start by doing this. So one, what is the question testing? Some don't know what the question is testing, and then some know what the question is testing. So now I'm not going to ask. So for you that don't know what the question is testing, right? How would you be able to answer this question? You're like, I might just think about it, use critical thinking. There is no critical thinking without knowledge. There is no critical thinking without knowledge. You see, that critical thinking is coming from a particular understanding. You cannot critically think what you don't understand. You cannot rely on critical thinking when you don't have knowledge. So you need to have that content knowledge so that you can be able to critically think appropriately. Right. So that is how NCLEX works. Now, when you know what the NCLEX is testing, the next thing is you want to know what I said, what is the NCLEX testing, right? So the second one is what is the examiner asking? That's what you want to know. What is the examiner asking? So it's just like right now. Let us say the question is saying you are caring for a client with COPD. So the question is testing you related to a client with COPD. You are caring for that client. Now the examiner is not saying, Which of the following nursing action should you do first? So you have the client that you are caring for. Let's say this is the client you are caring for with COPD. And then the examiner is now saying, which of the following actions? So the examiner provided 4 actions and they're asking, which one are you going to do first? So you are going to look at everything right here and decide which one you're going to do first for this client. You see, before you can have the ability to think through the answers, right, which is the third part, think through the answers. Before you can have the ability to think through the answer, you need to firstly know what the question is testing. How would you not know what the question is testing and you want to think through the answer? Are you performing magic? How would you not have the key to your door and you expect the door to open? Maybe you are a magician then. Because that's the only way I know you can open the door, or maybe you break open the door. Maybe you broke the door. And something similar to breaking the door is you cheating on the NCLEX exam. Because if you don't have the key, you can open the door. If you decide to break the door, it's just like you don't know what the NCLEX is testing. You cannot be able to answer the question. If you decide to do anything else, maybe it's cheating. Right. So you need to know what the NCLEX is testing. Right? So, and you need to know what the examiner is asking. You can know what the NCLEX is testing, but if you don't understand what the examiner is asking, you will still fail at answering the question. It's just like now you can know that we can use a key to open a door. But if you don't have the right key, would you still be able to open the door despite the fact you have a key? No, because not only you don't only need to have that knowledge, knowing that we use key to open our door. You also need to have the right key. So you don't just want to know this is what the NCLEX is testing. You still want to understand what the examiner is asking related to what the question is testing, so that you now have a perfect understanding. So you're like, oh, we are caring for a client with COPD. The examiner is saying we should do something first. So let me look at everything right here and see which one we can do now and leave the rest for later. You see, I have an idea. Not only I have an idea that we are caring for a client with COPD, I have an idea from the examiner question that we are only trying to do something first. So there's possibility everything will be something we can do for this client with COPD, but I'm going to start with the first one and leave the rest for later. Simple. So these are the 3 most important things you do when you are answering question. So now when I put a question on the screen, I ask the student, what is the question testing? Some will know, some will not know. So those ones that don't even know, I already told them there's no how on earth you'll be able to answer that question. Except if you randomly pick an answer by second guessing yourself, and then you are lucky you got the answer. It can happen. Right. But if you follow that way, right, I can guarantee you are just working yourself up to your next failure. Maybe you are taking the NCLEX exam for the first time, you are definitely working yourself towards failing the exam. But if you are taking the NCLEX exam multiple times and you are trying to answer a question without not knowing what the question is testing, or you don't even have knowledge related to what the question is testing, you are literally just going to fail the NCLEX exam again. So now, you can easily now understand where you stand, right? When you try to do this, you can just pick a particular question and ask yourself, do I know what this question is testing? If the answer is no, obviously you cannot be able to answer that question. If the answer is yes, now the next step is, do you have the right knowledge to that content? Like you can figure it out and say, oh, this question is testing COPD. Okay, do you have the right knowledge related to COPD? Right, so if your answer is yes, then we can move on to the next step. But if your answer is no, obviously you cannot answer that question. I don't know what you can do in order to answer the question. Right, now, if you have the right knowledge, now the next thing now is you want to understand what the examiner is asking. So what is the examiner asking? The examiner is saying you should do something first. right? So your knowledge will now tell you that, okay, yes, we can do this, we can do this, we can do this, we can do this. But the examiner is only asking us to do something first. So I'm going to now look at it and say, oh, okay, this is the most important one. We can leave this for later, and then we do this first. So that is from the understanding. Your understanding is that, okay, the NCLEX is saying we should do this, something first. So it means that everything can be done, but we are deciding what to do first. So if you have that understanding about the examiner question, we can answer the question. But if you don't have that understanding about the examiner question, there's no how you'll be able to select the correct answer, except if you get through it and then you are lucky. But if not, it will be difficult. And that is the reason why you get yourself stuck between two answers, or you are going to the answer and then you feel like all the answer in that particular question are all correct. It's just like now, if you're answering a question that is saying, what do you do first? What do you do first means that every answer in that question are correct, but it's just that they want you to do something first before the other ones. So now, if you are reading that kind of question and you don't understand that examiner question, and then you are like, but you are not like, oh, but we do this for COPD, we do this. You're like, well, we do everything for the client. So what is the correct answer? You're like, I don't know how to select the answer. Why? Because you don't understand the examiner question. Right. Things like priority. Priority. What's the most priority? The most priority, what that is telling you that everything can be something you will do, but there's one that is just your priority to do now based on the client situation. Right. What do you do best? It means that everything can be done, but there's one that is the best. Most important. Everything can be important, but there's the one that we will consider most important. Immediate intervention. It means that everything we need attention to, but this only one we require immediate attention. Immediate follow-up, same principle. So when you go on the NCLEX exam and then you are thinking this answer is correct, this answer is correct, there's probability that you are not understanding the examiner question. Right. Or you don't really know how to go through the answers. Right, which brings us to the third part. So if you don't have problem with understanding the examiner question, then we could come down to the third part. You want to think through the answers. So now when you are thinking through the answer, right, and you are getting stuck, the first thing I said, if you find yourself being stuck between two answers, or you think every answer in that question is correct, right? Is it that you don't understand what the examiner is asking, or you don't know how to think through the answers? Now, when you are thinking through your answers, you are doing three things. One, you want to understand that answer. When you have a clear understanding of that answer, you want to link that understanding to what the question is asking and what the question is testing and what the examiner is asking. So that's what you want to do. I will give you a particular example right now so that you understand what I'm saying. Let me erase this part. Right, let me erase this part. Now, let's say you have a particular question that is saying you are caring as a nurse for a client with COPD. So this is what the question is testing. Right? Now, the examiner is asking which of the following nursing action, let me just put nursing action, should the nurse take first? So this is the examiner question. This is what the examiner is asking. So let me just put asking right here. Right. So now, let us say number one answer is saying you should limit fluid to 500 ml. Now, so we understand what the question is testing, right? Now, we have a nurse who is caring for a client with COPD. So now, in our head, we are thinking everything COPD, 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 right? Now, the next part is now asking for the nursing action. What do you do for? So you are like, okay, so I will go through the answers, right? And I will see which one. Okay, let me retweak this question because the answer is not related to the question. I'm just trying to like pick something. Let me say, let me retweak the stem. You are caring for a client with COPD, or you are creating a plan of care for a client with COPD. So the examiner is now asking which intervention, right? Which intervention should you include into the client plan of care? So let's leave it like this. The answer is limit fluid to 500 ml. One of the answers. Right. So you understand what the question is testing. You are creating a plan of care for a client with COPD. And you know your plan of care includes your assessment, diagnosis, planning, intervention, evaluation. So out of everything in this plan, NCLEX is trying to test you related to the intervention part. And the NCLEX is not saying, the NCLEX examiner is trying to ask you a particular question related to the intervention, right? Now, the examiner is not saying which intervention should you include. Right. So I don't really love how I explain that. Let me re-explain it again, right? So what's the question testing? Plan of care, right? You are creating a plan of care for a client with COPD. That's what the question is testing. Right. So plan of care has all these 5 parts: assessment, diagnosis, planning, intervention, evaluation. Now the examiner is now saying, okay, we want to test you related to the intervention because that's what the examiner is asking right here. Right? The examiner is asking you related to the intervention. So the examiner is now saying, which intervention are you going to include? So they provided you 4 interventions and they want you to include. So I just gave you one of the intervention, which is limiting fluid. So now you already understand what the question is testing. You know what the examiner is asking. The third part is to think through the answer. And when we think through the answer, this is what we do. Right. So now we want to understand the answer. The answer is saying we should limit fluid to 500 ml. And when you are trying to understand your answer, you want to always understand the why. Nurses think by asking themselves, why? You understand? Why? It's just like, let us say you want to give medication right now. Before you give the medication, you ask, why? Why should you give it? And why should you not give it? Because you might have every reason to give it, but still kill the patient. Let me give you an example right here. Let us say you want to give beta blocker to a client. And then this client has a blood pressure of 166/98. Now, is there a reason to give that beta blocker? Yes, because the blood pressure is high. Now they said this client also have history of asthma. Now, there's a reason to give the beta blocker because beta blocker is used for increased blood pressure. Right here we have 166/98. There's a reason to give it, right? Are you following? There's a reason to give it. Now, but why should we not give it? This is the why not. Because you don't give beta blocker to a client who have asthma. But there's a reason to give it. You see, that is how NCLEX work. So when you think through this answer, you are asking, why do we want to do this? And is there a why not to not doing it? So why do we limit fluid? We limit fluid if the client have fluid overload. So now that's the understanding. So when you link that understanding related to what the question is testing, then you ask yourself, is COPD a client that suffers from fluid overload that will cause us to limit their fluid? The answer is no. So that is the why not to not do this intervention. Then you exit out. So because there's a why not, this answer is not correct. There are some certain answers that will be correct to what the question is testing, and then it will be wrong to what the examiner is asking. Am I communicating? Right. So when you understand the answer, it must be correct to what the question is testing and also be correct to what the examiner is asking before it become a correct answer. If it's not correct related to these 3 things, then you will have confusion if the answer is correct or not, because you will start beating around the bush and say, oh, why do we do this? Why do we do that? I'm stuck between these 2 answers. I feel like every answer in this question is correct and all that kind of stuff. Now, let me give you another example. Let me give you another example real quick, because I want to introduce the plan so that you see how important it is to follow a plan. Now, let us say you have a question that says a nurse is observing a staff member care for a client with chicken pox. So chicken pox. And then the question is saying, which of the following staff member action, right, would the nurse intervene? Meaning, if this staff member do something wrong, the nurse should intervene. And the first answer is saying, place the client, right, in the monitored negative air pressure room. Let me just put it short like this. Let's understand what the question is testing. It's saying a nurse is observing another staff member caring for a client with chickenpox. That right? That's what the question is testing right here. Now, the examiner is now asking, which of the following staff member action should the nurse intervene? And I've given you one of the action right here. So this is one of the action. Now, when we are now thinking through the answer, then we are now like, okay, place the client in a monitored negative air pressure room. So I'm not like, why do we do that? This is for clients with airborne infection. So now with this understanding, I'm going to link that understanding to what the question is testing. So is this a correct action to do for a client that we are caring for who has chickenpox? Yes, because chickenpox is an airborne condition. So you see, if you only rely on this understanding related to what the question is testing, at this point, this answer is correct because we want to place clients in a monitored negative air pressure room because it's airborne in not in action and the condition is an airborne. Now, if you link that understanding now to what the examiner is asking, it become a no. The answer now become the wrong answer. Why? Because the examiner is not asking for what is correct. The examiner is asking for the nursing action that is wrong. So this is a correct nursing action. We expect the staff member to carry out this action. So it's a correct nursing action, but the examiner is saying which of the following staff member action should the nurse intervene? Meaning you are not looking for the correct action that the staff member performed, you are looking for the wrong action that the staff member performed. So when this is a correct action, we are not looking for the correct action. This is going to be wrong. We are looking for the wrong action. Now, another answer was now like use face shield. Now, when you think about face shield and you ask yourself, so face shield is for what? Face shield is for standard precaution, right? And we are dealing with airborne. For airborne, we use N95. So when you link this understanding to what the question is testing, which is chickenpox airborne, it's not correct because face shield is for standard precaution, N95 is for airborne. So it becomes wrong. So this is our wrong staff member action. The staff member should not be using face shield. Instead, the staff member should be using what? N95. So that becomes our answer. You see how it works? Right. So now I will recap one last thing before I go to the plan. So I'll recap one last thing before I go to the plan. Right. So let me erase all this right here. Okay, let me just do like this. I always used to like erase it like this. Okay, so I just delete. All right, so yeah, so let me recap. Now, you see, like I said, when I show the student the plan, few want to do it, few don't want to do it. Until they see themselves getting questioned wrong, right? That's when they start asking. So, coach, how do I answer this question? Then I walk them through the 3-step process. Do you know what the question is testing? Do you know what the examiner is asking? And do you know what each answers are saying related to what the question is testing and what the examiner is asking? So most of them, their problems start from here. Most, yeah, and most all. So now, how do you get to fix this problem? Then that brings us to my plan. So now when they see themselves having a problem, that is when they now see the importance of the plan. You see, when students started with question bank, which you might be listening to me because you started with question bank and question bank did not work for you. You've tried content review, not working. You switched from different program, not working. Now you are here, right? Now, when students try question bank, they answer that question, they suspect it's content problem, right? And they think it's content problem. They start studying content. You see, they start trying different things. So it's when you answer question, right, and you're unable to answer the question, these are the things that are causing you not to answer that question correctly. It's one of these things. And in order to fix these things, right, there are 5 ways, right? I will not say 5 ways, right? There are 5 steps. No, it's not 5 ways, 5 steps. And like I said earlier on, this is it right here, 5. Right. Now, one is you want to understand the NCLEX. When you are trying to understand the NCLEX, you want to know what the NCLEX is testing. Right. When you read this question right here, and then you are like, I don't know what the NCLEX is testing. It's because you don't even have an idea what the NCLEX test. Because once you know what the NCLEX test, you'll be able to read this question and identify what the NCLEX test. Right. So when you know what the NCLEX test, the next step is for you to understand the content. Now, when you are trying to understand the content, what are you trying to do? You are trying to get the list of all content, the NCLEX test. You are trying to study them and then have the right knowledge. Right, like I said, some students can identify the content in the question, but they don't remember, either they have not studied it or they don't remember what they study about that content. So that can be another reason why the students are not answering the question correctly. Now, if you have done this, the third one is you want to understand the question. Right, like I said, it's not just by having a key, right? You want to make sure you have the right key. You understand? Now, it's not just by studying nursing content. You want to make sure you are studying the right content for the NCLEX exam, because nursing content can be either topic and it can be nursing activity. NCLEX tests nursing activities. That's what NCLEX tests, not topic. NCLEX says what you will do as a nurse so that they can see how you act. So they present a particular thing they want you to do and they try to see how you act related to that thing. Right. So you want to have the list of all these nursing activities, study them, have the right knowledge. You understand? Have the right knowledge. Now, for the question, when you are trying to understand the question, you want to know how the NCLEX write the question. You want to know how to break down the question. Right. Now, you want to know the reason why you want to know how the NCLEX write the question is because if you don't know how the NCLEX write the question, you will not know what to pay attention to when you are answering your question. You will just be all over the place. You will second guess yourself. You are going to overthink the question. But once you know how the NCLEX write the question, you say, okay, this is the first thing I need to look at in the question. So when you know how the NCLEX write the question, when you are breaking down the question, you say, okay, this is the first thing I need to look at. This is the second thing I need to look at. And this is this is the last thing I need to look at. And then you're like, oh, okay. So now you figure out this part, you figure out this part, you figure out the part, and it all leads you to the answer. Yeah, so this is how it works. You want to know how the NCLEX write the question so that you can have a perfect understanding how to break down the question. You get what I'm saying. Now, you want to have the list of you want to have a list of the right question as well to practice. You see, the same way you're having the right list of content to practice, you are not just practicing random content because they are all nursing content. Remember, I said we have 2 types of content. We have topics, we have nursing activity. Topic is what you did in nursing school. You can study topic and pass the NCLEX exam, but it's going to be difficult. The process is going to be difficult. So if you have failed the NCLEX exam, it means that that way of studying cannot help you because it's difficult and you failed. Now you should not even do it again. Because some people do it, they struggle, they pass. Because you can go the difficult way and still pass. But if you have done that difficult way and you do not pass, then it's time for you to do what is right. Focus on nursing activity. Right, because topic don't tell you what the NCLEX will test, but nursing activity tell you what the NCLEX will test. You understand? It's just like take for instance, advanced directive, right? Advanced directive, and then we have integrate advanced directive into the client plan of care. Now, pay attention to these two nursing contents. One is advanced directive, another one is integrate advanced directive into the client plan of care. If you decide to go and study advanced directive now, this one, you are the one that you will be asking, what will the NCLEX test? With the NCLEX test definition, with the NCLEX test the types, with the NCLEX test the ethical guideline, like you will just be all over the place thinking what the NCLEX will test. But this is also the same as this. The only difference is that this one right here is not presented in form of topic. Instead, it is presented in form of nursing activity. So it tells you directly what you are going to be tested on as a nurse. So instead of studying this and have to be thinking what the NCLEX will test from advanced directive, you instantly already know what the NCLEX will test, which is the NCLEX want to test how you integrate advanced directive into the client plan of care. So if you are a normal person with no recent brain injury, you will agree with me that it is going to be very easy to study this than this. Because all I just need to just do is just get the information to how we integrate advanced directive into the client plan of care, study it, see question on the NCLEX exam, and be able to answer it. Unlike advanced directive, I will be like, will the NCLEX test me the definition? Will they test the type? Will they? I will have to be hoping that what I've studied show up on the exam. But with this, I'm not going to hope because I am in line with what the NCLEX want to test. So if you rely on hope, it will be difficult for you to pass the NCLEX exam. But if you rely on certainty, it will be very easy for you to pass the NCLEX exam. So one, you need to know the NCLEX focus on nursing activity. Then you need to have the lists of all these nursing activity NCLEX tests. You study them, you have the right knowledge. You are done with the second part. Now, once you have the right knowledge, the next part is for you to now practice question. But before you jump into practicing question, you need to know how the NCLEX writes the question so that you can know how to break down the question. Because you can have the right content knowledge and see the question and be like, oh my God, this question is very hard. But it's not hard. The reason why it's hard because you are not used to those kind of questions. You are used to nursing school exam, not NCLEX exam. So you need to understand first how the NCLEX writes the question. Because once you know how, then it will not be difficult no more. Then you know how to break down the question. When you know how to break down the question, then we apply that understanding to various questions. But you need to have the right list of questions to practice so that you can apply those understanding. So you are trying to look at the question, identify the nursing activity. You already have studied it and have the right knowledge. Then you apply the breakdown to that question. Now from there, you can now start applying different proven tests, taking strategies. Right. So this is the last part. So you start learning. Right. So you are proving test taking strategy that gets you faster to the answer. So when you are done with this, right? Now the fourth step is now your exam readiness. This is when you have done everything and you are like, okay, so yeah, you are not going through everything. So you have like the content, you are like going everything. You are saying, okay, I know this content, I know that content. This if NCLEX tests me about this, I know it. If NCLEX tests me about that, you are going to walk yourself through those content. Now, NCLEX have like 146 content, right? So that 146 content right now. So you go through each of them and say, if NCLEX tests me about any of these content, will I be able to answer the question? When you go through it, like you go through it, and then you are like, okay, yes, I can answer it. Now you will discover your strengths, right? You will discover your strength, and weakness. Right. So now you know your strength. Now you're going to prioritize on your weaknesses. Then you now say, okay, so these are the ones I don't feel strong enough with. So you start studying them because that's the period of readiness. Then again, you reassess yourself. You keep reassessing yourself. Do I know all this? Now, when you feel comfortable that you know everything, right? Then you are ready. That is exam readiness. You are ready. And when you are practicing question, you are seeing yourself doing above 75%, you are ready at this stage. You don't practice question and be happy because you're having 75% if you've not done all this. But what I see a lot of students doing, they want to skip all this part and just come right here, practicing question. It does not work like that. And then when you come to my DM and you are like, Coach, I don't know how to answer this question. And I'm asking you, what is the question testing? You don't know it. So how would you be able to answer the question in the first place? You barely know what the NCLEX is testing. You barely have studied those contents. So how would you be able to answer question? Is it magic? If you come to my DM and say, oh, coach, I know this question is testing this, and the examiner is asking this, but this is how I try to break down the answer, and I still find myself getting this answer wrong. Now, based on what I have explained about this question, tell me where am I missing it? That is where I come in and I start telling you, okay, this is the problem, that's the problem related to answering the question. But at the end of the day, you should have done all these parts. Because this is what you need to do on your own. I cannot study the content for you. You need to study the content. Am I communicating? If you have problem when if you like you try to study the content and then there's a particular understanding that is not still clear to you, you can reach out to me. Coach, I was trying to study this content and a particular part of this content is saying this. It's not clear. Can you really break it down for me so I understand? So I help you to simplify what you are studying. So that is the role of the coach, to simplify the process. Somebody that is preparing for a relay race already know how to run. They are only getting a coach to help them run better. Somebody that is preparing for a food cooking competition, right? Love to cook because you have to love to cook before you want to go for cooking competition. You are only getting a chef to help you cook the food in a way that it's possible to win the competition. So, as a student that you are trying to prepare for the NCLEX exam, you should be ready to know what the NCLEX test. You should be ready to study them. So me, in the aspect of going through this process, I walk you through them, which I've done right now, or which I'm doing right now, walking you through the process, the plan, right? And then when you get to the content part, make sure that you are getting the content. Oh, coach, I am this is what I've done today, right? These are the list of content. Like the first thing I'm even expecting is when you understand that the NCLEX test nursing activity, and then you want to study the list of nursing activity and NCLEX test. I expect you to tell me, okay, coach, this is the way I plan to study all these 146 content. I'll be studying this each day. You are studying for 60 days, right? That's the duration of the program. And then you say, okay, every day I will give you feedback to what I have studied. Okay, coach, I have studied this. Right. When I was studying this is what I understand. This is the part that I am not still getting. Or if you understand everything, fine. Right. But let me know, okay, I've studied this. Out of 100% student, only 20% will come back and give me feedback. I know out of everybody that I'm coaching, I know who's serious about passing the NCLEX exam. Some people don't even engage me in the whole process. Some people don't engage me in the whole process, but they can bring question and say I should help them answer this question without them not even like making me understand what they already understand about the question. Because I've given you the process. What the question, what the NCLEX says, the list of content to study, how the NCLEX write the question, how to break down the question. So now when you are trying to answer a question, you should be able to figure out the problem yourself. You should not be able to figure out the problem yourself. When you figure out the problem and you need me to now solve that problem, yes, that is where I come in. So you're supposed to be telling me, okay, this is the content I've studied. Okay, coach, I'm done with studying audio content. Now I'm ready to start practicing question, and I'm ready to start applying this breakdown method. So, coach, when I was trying to answer this question, I tried to identify that this question is testing this. I want to know if I am right. Coach, when I was understanding what the examiner is asking, I noticed that this is what the examiner is asking related to what the question is testing. Am I right? Coach, breaking down which of this answer, this what answer, this is what I understand about this answer, linking it to what the question is testing. Right. What you are understanding about the answer must be the same understanding as well to it what the question is testing. Right. So you read the answer, you say, okay, this is what I understand about the answer. Then you link it. Is it the same? If yes, then you proceed to what the examiner is asking. If yes, that becomes your answer. But if no to any one of those two, the answer is wrong. So when you look at it and say, okay, coach, this and that, then you will find out that you are progressing. All you just need to just do is keep doing this over and over again. For at least minimum 300 questions, you would pass the NCLEX exam. You will pass the NCLEX exam. You don't need too many questions to pass the NCLEX exam. You need to apply the right way, right, of answering question multiple times to be part of you, and then you pass the NCLEX exam. You have a bunch of key and you want to open the door. You don't need to try too many keys to see which one will open the door. You just need to know the right key that opened the door, and then look at the bunch without not even trying anyone. Pick that right key from the bunch and then put it in and open the door. It's simple. So you don't need thousands of questions. You just need to apply the right way of answering questions to few questions and you are good. You don't need all the medication in the world if you are sick. All you just need is the right medication that fixes that problem. You are good. Who is telling you need 1,000 questions to answer NCLEX exam? You've probably failed the NCLEX before. You've seen all the old questions on the exam. So why is it that in your second attempt you did not still pass, despite seeing the questions before? And then somebody that is taking the NCLEX exam for the first time is passing on their first attempt, and you have seen the NCLEX exam and you have to take the exam the second time and you still fail. So the problem is because you don't understand the process of passing, and this is the process. And every single time students come to me and they bring question, is one of these three things that is the problem, right here. Is it that they don't know what the question is testing? They don't understand what the examiner is asking. They don't know how to go through what each answers are saying related to what the question is testing and what the examiner is asking. It's one of these problems. And when they don't know what the question is testing, is the fact that they don't know NCLEX test nursing activity, they have never studied the list, or maybe they know what the NCLEX is testing, they don't know the knowledge related to what the question is testing. Or they don't understand what the examiner is asking, then it's all messed up the way they answer the question. Or they don't even understand how to go through the answers. So once you've done all this, you start now, try to like go through everything you have done so far so good. That's the period of exam readiness. That's what you do during that period. You try to go through the content part. So content part first. Okay, what do I know strongly and what do I still struggle with? Then you focus on what you struggle with. Now, which question am I able to answer strongly and which one am I still struggling with? That's when you try to answer question and see. So you see those ones you confidently answer this and that. Most times I always just used to have like a blank list. Then I'm going to divide it into two, and I'm going to say these are the content that I can beat my chest. You can put a gun to my head right now, and I will tell you about those content. I will write it here. And the other side, the ones that I know, I'm not that good. When it is question, right, I will say, okay, these are the questions that if you put a gun to my head, I will tell you I will get those correct answer. Right? But these ones I will say, yes, I'm not really sure. You understand? That's what I did on the NCLEX exam. Right. I looked at most of those questions. There were some I'm 100% sure I got the answer. And there are some I'm like, I'm 75% sure, but I'm not really sure. But there are many that I know this I am sure. So when I was done, I already know I passed. Right. So That is pretty much how it works. So when you've done that, all you just want to do is forget your strength for now and focus on your weak area until you convert every of your weak area to your strength, and then you are good to go. Now, one thing a lot of students make mistake in this part, right, is they think about perfection. There was a particular student we were doing question on Zoom. When I asked everybody to grade themselves, she said she had 4 out of 7 questions, she had 4/7. And some people are like 7/7, some people are like 6/7, and felt like she was doing bad. And I said, don't think about what you are doing bad. Think about what can you do better, right? She took the exam before any of those students on the Zoom that day, and she passed in 85 questions. But she was worried few days before her exam that she had 4/7, and she was doubting if she could pass. So it's not about perfection, right? You just want to believe that you are doing the right thing. And when you find yourself making mistake, fix that mistake. So that on the day of the exam, you are still going to make mistake on the day of your exam. I can 100% guarantee you that. But you will not make as much mistake that will cause you to fail the NCLEX exam. I know that one for sure. You will not make as much mistake that will cause you to fail the NCLEX exam. Right. So now when you are done with the exam readiness, the last part, which most students skip, is exam execution plan. Now, most coaches, most people will tell you when you are getting closer to your exam, you need to rest. Don't study no more. But you are likely somebody who have failed the NCLEX exam before. So why are you here? Why are you not resting? Why are you not resting? Because there's no rest for you, because you need to pass the NCLEX exam. The only time you get to rest is when you pass the NCLEX exam. If you don't pass the NCLEX exam, you keep studying. So there's no rest. It's let me say, it's not making sense to me, right? Or meaningless for you to rest few, like 24 hours before your exam. Right. Instead, you can prioritize studying areas on the NCLEX exam that show up on the NCLEX exam every single time within your last 24 hours. Right. So that way you go on the NCLEX exam, you see those content, you're able to answer them. That gives you like a boost in passing the NCLEX exam. So you want to create a plan that make you study those top tested area 24 hours before your exam, the morning of your exam, and 1 hour before your exam. So 24 hours before your exam, you are actually studying those commonly tested content. Morning of your exam, you are revising them. And 1 hour to your exam, you are just reflecting. That's what you are doing. Right. That's what you are doing. So this is the plan. This is it right here. This is what you are doing for 60 days. So who is telling you that the NCLEX is difficult? The NCLEX is not difficult. You are not just doing what you need to do in order to pass. Now, the most important thing right here that you need, there are just two things, right? These are important, but like I said, the most important is you need to know the content and you need to have the right knowledge to that content. And you need to know how to break down the question, because you can be so smart. If you don't know how to break down the question, I can 100% guarantee you will struggle with answering an NCLEX question. You need to know it's not difficult, right? And to break down NCLEX question is not difficult, but many students are used to nursing school way of testing questions. So they don't pay attention to key parts of NCLEX question. So they just rush through the question and hope they will answer the question. They miss out vital clue and then they select wrong answer. And it's easy to select wrong answer on the NCLEX than in nursing school exam, because the wrong answer will be very obvious in nursing school exam. But on the NCLEX exam, all those answers will just be calling you, pick me, pick me, pick me, because they are like sweet answers. Imagine NCLEX is saying, verify client identity. Okay, related to blood transfusion, the NCLEX is now saying, verify with another nurse. We can both agree that yes, we verify with another nurse. Now the NCLEX proceeded by saying, using the client room number. Now many students just got attracted to the fact that the NCLEX said verify with another nurse. Immediately they are selecting it. That's the answer. They were not patient to see the part that said using the client room number. Do we use room number to verify? No. So even if NCLEX started with something sweet, you need to pay attention to every single information. Every single information must be correct before you can decide that that's the answer. Some students were able to spot the room number, and where many students did not even spot it because they were like saying, "Oh, we verify with another nurse during blood transfusion." Somebody was arguing with me, telling me the answer is correct. I did not tell her why the answer is not correct. I told her, read the answer again. She still insisted that the answer is correct. She even had to call somebody to verify that the answer is correct. But I told her, when you call the person, what did you tell the person? He said, I asked her if we verify with another nurse. I said, is the only verifying with another nurse that is in this answer? She said, no. Then read all the answer. I said, okay, what do I need to read there again? I've been reading this over and over again. Then I told her, do we use room number to verify client identity? She said, no. I said, so why do you think this answer will be correct, even if the NCLEX said verify with another nurse? Because there's already a wrong statement. So this wrong statement already make the whole answer wrong. She said, okay, so but if there's a wrong statement, why is it that the NCLEX is starting with the right statement? So she still have this confusion. So our problem is not the content knowledge. Our problem is that she don't understand how the NCLEX writes the question. There are three parts to every NCLEX question. There's the body of the question, there's the stem, and there's the answers. When NCLEX want to write the body of the question, is like a scenario. It can either be short or long. NCLEX will write it related to the nursing activity they are testing. When NCLEX is writing the STEM, they will look at that nursing activity, think about what they want to test you related to that nursing activity, or ask you, related to that nursing activity, and they will write the examiner question. Now, when NCLEX want to write the answer, they look at what is correct about what they're asking you. They put it, and then they look at what is like a common error, misconception, irrelevant information. Now, you see that answer that is saying verify with another nurse using room number. Verify with another nurse is correct, but the room number is like a common error. Most nurses don't know they don't use room number. So people just say, oh, room number, so, and so. But the patient might not be there. They might have swapped the patient. So you are doing wrong verification. So we use the client first name, right? First and last name, the name, or just say the name, date of birth, and ID band. So the answer was like verify with another nurse using the client room number and ID band. The ID band was correct. The verify with another nurse was correct. The room number was the problem in that answer. And then it made all that statement wrong. And then she was like, wow, you see, she only understood what I was saying, not because of I explained the answer, but I explained how the NCLEX write the answers. So that is a common error. It's a common error. So NCLEX used that common error to write that wrong answer while including something sweet. And then that sweet part attracted her, and she was arguing with me that that's the answer. So you want to know how the NCLEX write the question so you have the ability to break down the question, right? And keep practicing questions. You do your exam readiness, you do your exam execution, and you are good to go. So this is the plan. So I don't expect you to be confused. I don't expect you to be confused. Many people will reach out to me and they will say, Coach, it looks like you've avoided me. How am I avoiding you? I've given you the plan. Work with me with the plan. So you should be communicating with me. You don't expect me to come to your DM every time and start asking you, what have you studied today? I'm not forcing you to take the NCLEX exam. You know you need to take the NCLEX exam. You got a coach. Communicate with me. Coach, this is what I studied today. This is the content. You already know the content. Coach, this is the part of the content I've studied today. Tomorrow, this is what I'm studying. Right. What are key things do you feel like I should pay attention to? Like what are things do you know I think I should pay attention to when I'm studying this content? I can give you clues. Oh, coach, I'm done with the content. Now I've learned how the NCLEX write the question. I've learned how to break down the question. Now I'm trying to practice question. Now look at the question, coach, that I practiced today. You show me. When I was practicing this question, I noticed that this is what the question is testing. This is what the examiner is asking. These are what each answers are saying. And that's how I was able to like come up with this answer. Is my explanation right? Then I let you know. Oh, coach, I did all this. I still got the answer wrong. What did I do wrong? This is what I said the question is testing. This is what I noticed the examiner is asking. This is what I thought about each answers. And I got the answer wrong. Explain, coach, to me. Coach, I was trying to study this content. This content, this part of the content, I'm not clear about it. Explain it to me. That's how you work with a coach. That's how you work with a coach. That's what I'm expecting to you. So how am I ignoring you? You are literally the one not communicating with me. Right. So don't bring question to me when you cannot even explain to me these three things: what the question is testing, what the examiner is asking, what each answers are saying. Because that is what I'm going to still ask you. I'm not expecting you to be right. I just expect you to tell me those things. So if you are wrong, I'm going to correct you. I'm not saying you should be right about what the question is testing. I'm not saying you should be right about what the examiner is asking. I'm not saying you should be right about what each answers are saying. But at least don't come and then throw question to my DM and say, Coach, I'm struggling with answering this question. What is making you struggle? I need to see how you went through the question so I can identify what is making you struggle. So pick up your phone, send the question to me, record a voice message, and walk me through the question. And then I will listen to the voice message, see what you are struggling with, and then I'm going to assist you. If you study a particular content, you have a part you don't understand, screenshot it or use a voice message, send your concern to me. I'm going to help you understand that content better. And then when we have done all these things multiple times, when you have done it multiple times, you will be good on your own. And then you see some students, they don't communicate with me. Like I said, out of 100% students, only 20% communicate with me. Right. When you will see some students, they have never communicated with me, they are just there. And I'm watching from afar, waiting for them to communicate. And then when they come to my DM, they're like, oh, coach, my exam is on the so-so date. My exam is so-so date. What else do I need to know? What else do you need to know than everything that I have told you here? What else do I need to make you know? Like you see, people just try to complicate studying for the NCLEX exam. People, not before they even try to complicate it, they already think about the process as something complicated. They don't believe that it's easy to pass the NCLEX exam. So they have messed up the way they think about the NCLEX right here. And then they now everything their brain is telling them is to furthermore complicate the process. Okay, you selected your exam. Congratulations. So what else? Coach, that's when I'll take my exam. But you see them. They send the exam date to me and say, oh, I selected this date as my exam. What else do I need to know? So what else do I need to make you know than all this? Do I want to add a sixth step and then tell you the sixth step is that Donald Trump will be there in your exam center? Because I don't know what else you want to know apart from all these things. This is what help you pass the NCLEX exam. Because honestly, I don't. Maybe I need to tell you the amount of people that will take the exam in your center, and then tell you you will have like 5 supervisors, you will have like 300 students taking the exam. Some will dress like this. Some will dress like that. Because I don't know what else. Because this is what gives you the ability to pass the NCLEX exam. Some people will still come to my DM and say, Coach, I don't understand what we are doing. What don't you understand about this? It means that you are not concentrating on nothing. And how do you expect to fail the NCLEX pass? How do you expect to pass the NCLEX exam? And more reason why you are failing. More reason if you come to my DM after explaining this again and then you are saying, oh, I'm not clear about what we are doing, then there's a serious problem. Now, I wish you to tell students, program don't help you pass the NCLEX exam. You need to know how to pass the NCLEX exam. Mark Klimic have written NCLEX question for the NCLEX exam before. He stopped writing question for the NCLEX exam and created his NCLEX program. Some student, like yesterday, somebody reached out to me and told me I have used my clinic, bootcamp, and so other program, and they still failed the NCLEX exam. Does that mean my clinic don't know what he's doing? No, he definitely know what he's doing. Does that mean his program is not good? No, his program is definitely good. But it's a good program, but it makes some people pass and some people fail. The reason why those people that pass know how to pass. Those people that fail don't know how to pass. You can get somebody that passed the NCLEX exam and ask them about passing the NCLEX exam. You will see two types of people: the ones that can tell you how they pass, and the ones that cannot tell you how they pass. Somebody telling you, "Oh, when I was preparing for the NCLEX exam, I used this program." It doesn't that is not telling you how to pass. That is just telling you, okay, go and do the same thing I did and see if it will work for you. Because if you are trying to cook a particular food, listen to me, and then you did not succeed in cooking that food perfectly, and then you go to somebody that know how to cook the food, and then you're asking the person, how do I cook the food? And the person just saying, go just buy this ingredient, you'll be able to buy it. The same ingredient you got, you will still go back and cook trash. But if this person now walk you through a system at which you would use that ingredient, like if I teach you how to cook the food using the ingredient, you'll be able to pass. So it's not about the program that helps somebody to pass. It's how to use how do you know how to pass the NCLEX exam so that you can use that program properly in order to pass. That is how it works. So this is how to pass the NCLEX exam. So you implement what you need in order to pass. Like out of this plan, this 5 plan on the screen, the 2 most important things that will help you now pass, that you need to pass. This is knowing how to, what I picture out on the screen is knowing how to pass the NCLEX exam. Now, all of us now can now agree that, oh, okay, or me and you can now agree now that this is the way to pass the NCLEX exam. So now what are you implementing? You are studying the content, having the right knowledge, you are learning how the NCLEX write the question, knowing how to break it down so that you can answer question. It's as simple as that. Then you go through the readiness phase and you use your execution, the exam execution plan. Then it will be very difficult for you not to pass the exam. I can guarantee you that. This is the only way I know in the world that can take you from confused, lost, overwhelmed to become a licensed nurse. And I hope after this explanation, right, you know how to use a coach better.